also there's been this allegation that there is some form of suicide that runs down across the lineage of a family. You mentioned it at some point.
Yeah.
Now, how can someone break from that lineage where people have been committing suicide or something? Now you want to create some form of fresh blood out of it. Is it really possible for someone?
First of all, let's clear this.
Right.
It is not genetic. It may run in the family, but it's not genetic. What happens? What happens is that people learn from the family, right? And like I had said, one of the risk factors of suicide is mental health problems. And mental health problems are genetic. So chances are that another person in the family is likely to have that mental health problem. And it's important to know that there are some mental health problems that are more likely to lead to suicide. So the genetic predisposition is not about suicide itself, but maybe about mental health problems. So that you find that the mental, like for example, depression runs in the family. It's genetic. So, and what may also happen is that somebody who is contemplating suicide, if there is someone else who committed suicide in the family, it feels a little normal. They are likely to reason, well, even my dad committed suicide. So there's the aspect of learning, and you know, families are an institution where a lot of learning takes place. So there's modeling, you know, it's then seen as a method of dealing with problems. So they learn, they model those other people who committed suicide. And it is good to note here that sometimes when people are talking about suicide and other people are having issues where they are thinking like, what do I do to get out of problems? And suicide is really mentioned so much, then sometimes they see it as an option. When they hear it, then you know, the more they hear it, the more they think about it. So it is not about the genetic aspect of suicide, but the other risk factors that can lead to suicide.
Right.
So I don't think you can kind of stop the lineage per se, because you can never run out of your family genes. But I think people can unlearn. There are things that can be unlearned. They are coping. People can be helped to cope. One of the things maybe we should be saying as a preventative measure is to teach people life skills. You know, how do I cope with problems? What do I do when I have challenges? And I think one of the reasons why we are seeing a lot of suicide in the society now, people do not have the coping skills, or they're having a low self-esteem. So I think those are the factors to address, and not necessarily the genetic